heard of the movie called Constipation? No, because it hasn't come out yet. And did you know that constipation may actually be a side effect of the vaccine? Why? Because after you take the first dose, you will have to wait a few weeks for number two. Hello, everybody, it's Ryan here. Welcome to our 64th Mnemonic in the beautiful discipline of internal medicine. I hope you and your family are well. I bring warm greetings in the precious name of my Lord and Savior Jesus Christ. Today we're having a look at our beloved constipation and the possible differential in terms of causes for constipation. But first up, just some quick encouragement, guys. You know, we all sometimes get tired and weary in this life, and that's natural. But I just want to encourage you from the book of Isaiah, chapter 40, verse 27 through 31, which says, or let's just take it from verse 28 through 31. Do you not know? Have you not heard? The Lord is the everlasting God, the creator of the heavens and the earth. He will not grow tired or weary, and his understanding no one can fathom. He gives strength to the weary and increases the power of the weak. Even youths get tired and weary, and young men stumble and fall. But this is the main verse. But those who hope in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not be faint. Trust God, and He will rejuvenate you and strengthen and unctionize you. All right. So today our topic is constipation. So let's get into this, right? So causes of constipation. So first up is diet. All right. So in the way of low fiber diet or dehydration that can cause it. This is a bit of a doozy. So to make the mnemonic work, there's no real U, but I used a Greek alphabet symbolizing psychiatry. So people with depression and somatization and obsessive compulsive disorder also can be constipated. Right? Obstruction, in terms of bowel obstruction, what can cause it is any mechanical obstruction in the lumen of the bowel, or even coming from the wall or outside the wall of the bowel, like cancer and strictures, and very commonly adhesions as well. So in those who have previous bowel surgery or intra-abdominal surgery. Okay, there's a whole host of drugs that cause constipation, the likes of opioids, tricyclic antidepressants, neuroleptic agents, antihistamines, calcium channel blockade, iron, even antacids can cause it. Watch out for endocrine causes like diabetes. We spoke of gastroparesis yesterday, but you can also have hypothyroidism, hypercalcemia, hypokalemia, which can cause an ileus, right? Hypomagnesemia, uremia. Neurological issues that can cause constipation. Topping the list is spinal cord compression or injury, Parkinson's, right, as part of multiple system atrophy, multiple sclerosis, stroke, autonomic neuropathy, which is what we affectionately term the cachexia, anorexia syndrome. Sometimes we just don't know what causes the constipation. Miscellaneous causes include irritable bowel syndrome, which we will touch on just now, together with amyloidosis, scleroderma, and immobility. How do we investigate constipation, guys? So your labs will cover your full blood count with a differential, urea and electrolytes. You want to do your calcium, magnesium, phosphate, and a TSH, noting that hypothyroidism can give you constipation. Imaging, look at the abdominal X-ray for features of bowel obstruction, okay? So then, so how do we manage constipation? So first up is lifestyle changes. Encourage high fiber foods like high bran cereals, wheat bran. You can use psyllium husk or metamucil, 2 to 3 teaspoons per day. Encourage regular exercise, hydration. Emphasize that at least 8 to 10 glasses per day. Then in terms of controlling the symptoms, laxatives, in order of increasing potency. So you have decasates, 100 to 240 milligrams daily to QID. You can use senna, 1 to 4 tablets daily to QID, milk of magnesia. You can use sorbitol, lactulose, magnesium citrate, bicostidil or Darkalac suppositories, even tap water enema, even polyethylene glycol, right? And the dose of that is 250 to 4,000 mils, which is 4 liters maximum per us. If all of that fails, you can use manual disimpaction. For patients with spinal cord injury, it's very important to use rectal measures like enema suppositories, as significant diarrhea or leakage could occur with oral meds alone. And of course, if there's an underlying cause, you want to address that. As a quick note, guys, on irritable bowel syndrome. So the pathophysiology behind IBS is that there's a heightened response to noxious visceral stimuli such as balloon distension of the rectum and sigmoid colon. And clinical features is what we term the Rome criteria. So it's defined by more than 3 months of abdominal pain, relief with defecation, with associated change in the frequency or consistency of stool, plus 2 of the following for more than 25% of these days. So you have disturbed defecation, which speaks to more than 3 bowel movements per day or less than 3 bowel movements per week. So either constipation or diarrhea, right? Then altered stool formation, altered stool passage in the way of straining, urgency, or feeling of incomplete evacuation, passage of mucus per rectum, bloating, or feeling of abdominal distension. So remember, the Rome criteria involves these entities, all right? And it's associated, rather the associations of IBS. These patients are more likely to have functional dyspepsia, urinary symptoms, dysmenorrhea, dyspareunia, sexual dysfunction, proctalgia fugax, history of physical or sexual abuse, and fibromyalgia. We diagnose IBS as a diagnosis of exclusion. We consider flexible sigmoidoscopy or colonoscopy, evaluation of a celiac spree, right, and stool cultures to rule out other diseases. And how do we treat IBS? Just reassure the patient, try and encourage them to reduce their stress, fiber supplementation. For constipation-prone IBS, called IBS-C subtype, consider osmotic laxatives as first line, and then you can use things like linaclotide. For the diarrhea-prone IBS, the IBS-D subtype, consider loperamide and elocitron. Okay, if abdominal pain, consider antispasmodics like Hyoscine, which is Buscopan, right? You can use tricyclic antidepressants and SSRIs for abdominal pain. And sometimes we have these combinations with the, anti-spasmodic with your SSRI combinations, right? Cognitive behavioral therapy may also be useful. All right, guys, so this was constipation. And yes, this did come out. God bless you and have yourself a fantastic day. I'll see you soon with another mnemonic in the beautiful discipline of internal medicine. See you.